An article from the official website of the Centers for Disease Control and Prevention lays out 3 separate events that go as follows. In a period of 9 months, a tiny Kentucky county of fewer than 12,000 people sees a 53-year-old mother, her 35-year-old son, and 7 others die by overdosing on pain medications obtained from pain clinics in Florida. In Utah, a 13-year-old fatally overdoses on oxycodone pills taken from a friend's grandmother. A 20-year-old Boston man dies from an overdose of methadone only a year after his friend also died from prescription drug overdose. This speech is a response to an article titled "A Step to Curb Painkiller Abuses," written by the editorial board of the New York Times. The article claims that consumers will be less likely to overdose, though not as safe as they should be, under new labeling rules implemented by the FDA. The editorial board is wrong in thinking these specific revisions to the warning labels will work, and both the editorial board and the physicians that petitioned for these changes are addressing the wrong problems. Today I'll explain why it's my belief that they're going in the wrong direction by discussing, first, that warning labels don't work, second, that they're addressing the wrong problems, and third, what steps may actually be helpful in reversing the current trend in drug abuse. My first point, warning labels don't work. Reading fine print takes time and effort. In today's society, when you feel an ache or a pain coming on, there's a pill for that. People are busy and want a quick fix, and often neglect to take the time to pay attention to details. A Harvard study done on cigarette warning labels for 4 different countries gathered various data and research that implies cigarette users neglect to notice warning labels on boxes. The countries that combined the warning with a graphic or visual aid had significantly more people take notice than the countries that labeled with plain text. It's a commonly known fact by now that smoking often leads to cancer, which in turn leads to a slow, expensive, and painful death. If people ignore these labels, they're risking their health. So what makes a bottle different from a box? If the labels aren't the issue, then what would be the problem? Easy. There are 2 trending problems. The editorial states fatal overdoses from these painkillers more than quintupled among women and more than tripled among men from 1999 to 2010, when they killed more than 16,000 people and led many other users into addiction. Federal officials have called the misuse and abuse of prescription painkillers an epidemic. The first problem, how they get them. Some users engage in doctor shopping, where people obtain multiple controlled substances from multiple providers. Most prescription painkillers are prescribed by primarily care and internal medicine doctors and dentists, not specialists. Roughly 20% of prescribers prescribe 80% of all prescription painkillers. More than 3 out of 4 people who misuse prescription painkillers use drugs prescribed to someone else. The second problem is what they're taking them with. About 1/2 of prescription painkiller deaths involve at least one other drug, including benzodiazepines, cocaine, and heroin. Alcohol is also involved in many overdoses. CDC says in 2008, there were 14,800 prescription painkiller deaths. So different problems call for a different solution, a better solution. The CDC suggests in an article on policy impact, 36 states already use PDMPs, or Prescription Drug Monitoring Programs, which is an internet database to track controlled substances. Second suggestion is a patient review and restriction program, where state benefits programs such as Medicaid and workers' compensation programs should consider monitoring prescription claims and PDMP data for signs of inappropriate use. Third suggestion is a healthcare provider accountability, making sure that doctors and providers follow guidelines on proper prescribing. Fourth suggestion is individual state laws to prevent drug abuse and diversion, such as doctor shopping and pill mills. Last is better access to substance abuse treatment, which the CDC says are very important programs. An article written by Matthew Daneman at USA Today about more states focusing on prescription drug problem goes through and gives several examples of measures already taken by individual states to deal with the problem. Examples: Alabama made doctor shopping a Class A misdemeanor. Kentucky has enforced annual drug screenings for registered users. and many other states, other than the 36 that already do, are strictly enforcing the use of New York's iStop, the internet system for tracking overprescribing, which is similar to the PDMPs the CDC refers to. In conclusion, the editorial hit the wrong points in addressing the epidemic of drug abuse. It's important to lay off changes in labels and focus more on distribution and monitoring of the drugs. According to the CDC, enough prescription painkillers were prescribed in 2010 to medicate every American adult around the clock for 1 month. If we don't pay attention to who's giving out these drugs, we're very likely to lose more and more loved ones every day.